my name is Kylie Holiday, and today we're going to be mixing insulins. What we'll need is our patient, our insulin syringe. I've used up all my gauze, so we're going to pretend that this is in a package and it is aseptic. I know it's not, it would be so bad to use, but we're going to pretend. And alcohol pads, our medication, our sliding scale, and our MAR. So we're going to begin by going to the patient, checking how they're feeling, and seeing if they're NPO, if they feel like eating, are they sick, checking for signs of hyper or hypoglycemia, and doing head-to-toe assessment, vitals, and a glucometer reading for their blood sugar. We see that their blood sugar is 10.6, so then we can go to the sliding scale. Now the sliding scale and the medication needs to be checked against doctor's orders. So we can see here that the doctor's orders has called for Novolin NPH 22 units at breakfast, which is our intermediate acting, and he has said moderate dose, so we're going to do 4 units because, you know, moderate dose, you go to your 10.1 to 12, and we see that 10.6 is in the middle, and so that'll give us 4 units of our Lispro. That is our short acting. So yeah, we want to make sure that he's eating. Then we're going to take the medication out of the MAR. So now we're in Fixes. Take the medication out, get our needle out and all of our supplies. This is also my sharps container, I should mention. So first, we're gonna hand hygiene. We're gonna take it out and we're going to check all of our 7 rights. So we're gonna make sure that this is indeed short-acting Lispro. We're gonna be taking 4 units. It's for the right patient. It's at the right time. It's not expired, and it's good to go. Same thing with our NPO intermediate acting. Right medication, right time, right patient, right dose, all of that good stuff. Then we're gonna take our alcohol swab. I'm gonna swab down our medication. Great. Then we're gonna take our insulin syringe. And so first we're going to draw up 22 units of the NPH. Well, sorry, I should correct myself. We're not gonna draw up, we're going to insert 22 units of air into the NPH. We're gonna make sure that the, there it is, 22. We're gonna make sure that nothing, that the needle does not actually touch the liquid inside and that we don't draw any up. We're just inserting the air. So let's go ahead and do this. Insert 22 units into the intermediate, the cloudy. I should mention that I should have mixed this before. I'm realizing that now. I should have mixed it before. And I also need to check that both of these are at room temperature. So the cloudy you mix before, you can just do it in between your hands. But yes, so I've inserted 22 units. Now I'm going to insert 4 units into this lovely guy. 1, 2, there we go. I'm going to insert 4 units into the short-acting Lispro. Insert. And now I'm going to draw up 4 units. So come here, draw up. There we go. Now I'm going to draw up 22 units of the NPH, intermediate acting, but it'll be a total of 26 units. Insert. So a total of 26 units. There we go. And then making sure not to put any back in there. Just to get rid of the bubbles. This is when you would do your 3rd MAR check, your 2nd MAR check. And you also need a 2nd nurse to come and make sure that this is the right amount of insulin, the right dose for the right patient. But yes, this is where you do your second MAR check. Yeah, you would passively cap. There we go. You would passively cap. You would bring this, your sealed gauze, and an alcohol swab to the patient along with your MAR. So we bring this to the patient. Then we explain to the patient the medications if they haven't already gotten them before, explain what they're for, all of that good stuff, explain why they need to eat soon. So we come, again, check with their armbands, their patient identification, or ask their name and date of birth. But this is our final MAR check, so we really want to make sure that right patient, right medication, right dose, right time, all that good stuff. Now, there are many different places that you can give it. We're going to pretend that this is the abdomen, 5 to 6 inches away from the umbilicus. So I'm going to do hand hygiene again because now we've touched lots of things. Going to prep the skin area with an alcohol swab. At this point, I would also take out my gauze and place it on a aseptic surface, a clean surface. Then I would come to the patient, uncap. I would squeeze, insert at a 90-degree angle, and then go down, remove, stabilize, push down. Great. Remove. I would put the gauze on the patient, apply slight pressure. At this moment, I would also put the safety on and put into my sharps container. I did just want to say that you don't want to put too much pressure and you don't want to rub, just a little bit of pressure. At this point, you would, put into the sharps container. You would clean up your area. You would return the MAR. And you would check later that the patient does for sure eat some food. You would also check and monitor for signs and symptoms of hyper or hypoglycemia, and you would follow protocol, Fraser Health protocol, if it was either of those. But yeah, that's it. We just return the MAR, return the medication. Thanks for watching.